So CKD, or chronic kidney disease, is the progressive loss of kidney structure or function and has to be present for more than 3 months, which then makes it chronic. The GFR, or the glomerular filtration rate, is used to stage chronic kidney disease. So there's 5 different stages. Stage one, you have 90% or more normal kidney function. Stage two, you only have 60 to 89% normal kidney function. This is mildly reduced. Stage three, you have 30 to 59% of normal kidney function. And then stage four, you have 15 to 29% normal kidney function. This is severely reduced. Stage five indicates kidney failure, and this is less than 15% of normal kidney function. So some signs and symptoms that usually don't occur until stage four. So this is very late within the disease process. So which is why it's important to receive regular follow-up, to draw routine labs and be able to determine what your kidney function is to be able to address the problem before it gets to stage four. So in stage four, if you do end up having signs and symptoms, you could have dry mouth, nausea, vomiting, anorexia, muscle cramps and weakness, dry or itchy skin, fatigue, bubbly or foamy urine, and a headache.
I'll be going over the causes of CKD and the exacerbations of CKD. Causes of CKD include diabetes, high blood pressure, glomerulonephritis, which is inflammation of the glomeruli, interstitial nephritis, which is inflammation of the kidney tubules and surrounding structures, prolonged obstruction of the urinary tract from conditions such as enlarged prostate, kidney stones, and some cancers. Two other causes of CKD includes recurrent kidney infection, also called pyelonephritis, and polycystic kidney, also known as PKD, which is a genetic condition where fluid-filled cysts gradually damage kidney tissues. Exacerbations of CKD include volume depletion, such as dehydration from vomiting or excessive diarrhea, infections like urinary tract infections or sepsis, uncontrolled hypertension, poor control diabetes, urinary tract obstruction, cardiac issues like heart failure, electrolyte imbalances such as hyperkalemia and acidosis, and lastly, nephrotoxic drugs such as NSAIDs like ibuprofen.
These are going to be your diagnostic tests. You have your GFR, the most commonly used, your glomerular filtration rate. It's going to be a measure of how well the kidneys filter blood. And this measures creatinine levels in your blood, a waste product. A reading of 0 to 15 GFR would indicate kidney failure, and 90 to 120 would indicate normal kidney function. Your BUN test, your blood urea nitrogen. Damaged kidneys can't filter BUN as well, so it would be elevated in your blood. In a urine test, albumin would be present if you had damaged kidneys because healthy kidneys don't filter albumin, and damaged kidneys do, and it shows in your urine. And then you have your imaging tests, your CT scans, your MRI, ultrasound. These are going to be to visualize changes. Treatment options are going to be limited because chronic kidney disease is not reversible. It can only be slowed from progressing any further. And since your kidneys don't work as well, we're going to do what the kidneys do with a machine. So we're going to filter, clean your blood, and then give it back to you. And then you're going to have your medication, your blood pressure meds, and your diuretics. Help with swelling, help with anything that you're retaining, any waste. It's going to help you accrete it a tiny bit. And then, of course, kidney transplant, getting an entirely new kidney. It's going to be your best option. And then what makes CKD, chronic kidney disease, better or worse? So better, controlled blood pressure, proper diet, proper hydration, regular exercise, and then, of course, medication adherence. Keep taking your blood pressure meds, keep taking your diuretics. And what's going to make it worse? Uncontrolled diabetes, high blood pressure, smoking, poor diet, dehydration, overuse of medication like ibuprofen or Advil, and then infections like UTIs. If you have any symptoms, you're going to want to go to the doctors immediately.
The goal of care for patients with chronic kidney disease is to protect their remaining kidney function. We do this by controlling blood pressure and diabetes. It is also important for the nurse to prevent complications such as fluid overload, anemia, and bone disease. The nurse will also support quality of life by educating and preparing the patient for possible future treatments, such as dialysis and kidney transplant. Common nursing care seen in patients with chronic kidney disease. The patient will be monitored through their vital signs, daily weight, intake and output, and their recent lab results. The nurse will manage their medications through blood pressure, diuretics to reduce swelling, erythropoietin to treat anemia, and phosphate binders to protect their bones. Management of their symptoms such as shortness of breath, muscle cramps, confusion, itching, nausea, and loss of appetite will also be important. Important lifestyle changes to protect your kidneys. The patient should attend regular doctor's visits and get regular labs and report any worsening symptoms immediately to their primary health physician. Avoid smoking and drinking alcohol as this speeds up kidney damage and increases the risk of heart disease. The patient should stay active with light activities such as walking or gardening and avoid overexertion in extreme heat to avoid dehydration. The patient should control their blood pressure and blood sugar by taking their medications as prescribed and monitoring regularly at home. The patient should also stay hydrated by following their doctor's daily fluid intake recommendations. It is also important for healthy eating lifestyles. The patient should limit salts, processed foods, and foods high in potassium and phosphorus, such as canned foods, deli meats, processed cheese, bananas, potatoes, and whole grains.
So, a simple community resource that can be used in the San Joaquin area is first the San Joaquin Kidney Clinic. It is located in 3 locations, which is in Stockton, Lodi, and Tracy. Basically, it's the biggest corporation in which can help treat chronic kidney disease and high blood pressure, which tends to be the main cause of chronic kidney disease. And so they have listed missions in which their aim is to improve quality of life with those who do have kidney disease, and their top goal is to become a top provider of kidney care in the San Joaquin County area. A second resource that individuals can use is called St. Joseph's Kidney Smart Class. So St. Joseph's Kidney Smart Class is a class that happens monthly every third Monday, and it basically helps individuals who do have chronic kidney disease or are looking to prevent chronic kidney disease into taking an information class regarding this disease. So they go over how this disease works, what kind of causes it, what are the symptoms of CKD, and what they can do to prevent CKD. So lifestyle changes in which can reduce high blood pressure or to prevent the kidneys from becoming inflamed and damaging the nephrons of the kidneys. In conclusion, chronic kidney disease is very serious. It affects a huge population of people in the San Joaquin County area, and the most silent of factors includes hypertension and damage to the nephrons. But those are also preventable factors. And however, this San Joaquin County area does provide resources in order to help individuals located here to prevent their CKD from progressing any further. And for those who don't want to get chronic kidney disease, so they can change their lifestyle into keeping their kidneys protective and safe. And these are our resources. Thank you.